Hello, my name is Sabri. I'm a postdoc in nutrition at Harvard School of Public Health. I'm very happy to join you today to discuss results of a project that my colleagues and I have been working on over the past couple of years to develop and validate a novel food-based metric of diet quality for global use. To give you some background, there's currently no global standard metric of overall diet quality. Existing metrics capture either nutrient adequacy or non-communicable disease risk, but not both. They're often quite population-specific, and they sometimes call for data on nutrient intakes, which requires food composition data to calculate, which is not always easy or practical to do. To address this, we developed a global diet quality score, which is entirely food-based, employs a modestly expanded list of foods relative to other metrics, and incorporates a simple portion size assessment, in which the intake of each food group is classified as small, medium, or large, based on grams per day cutoffs specific to that food group. These features allow our metric to account for foods of nutritional importance across a wide range of global diets, and predict dimensions of both nutrient adequacy and NCD risk without requiring the use of food composition data. The GDQs consists of 25 food groups considered to be globally important contributors to nutrient intake or NCD risk, based on nutrition science and the epidemiologic literature. There are 16 healthy food groups, which are scored by giving points for increasing amounts of intake, 7 unhealthy food groups that are scored by giving points for decreasing amounts of intake, and 2 food groups which are scored in a non-linear fashion, which means we give points for increasing amounts of intake up until a threshold, after which we give 0 points. And the overall GDQ score is obtained by summing up all of the 25 component point values, and this score intends to reflect overall diet quality with respect to both nutrient adequacy and NCD risk. To develop the GDQs, we used an iterative validation process based on extensive secondary analysis of cross-sectional and cohort data on non-pregnant, non-lactating women from different regions of the world. To do this, we recreated the GDQs using FFQ and 24-hour recall measurements in each validation dataset. And within each dataset, we determined how the GDQs associates with different aspects of under and overnutrition, including energy-adjusted intakes and adequacy of 8 nutrients considered high priority for developing regions, anthropometric and other clinical measurements, and disease status. We also validated positive and negative GDQs submetrics, which are scored using only the healthy GDQs food groups or only the unhealthy ones, respectively. And we also validated 2 existing diet quality metrics, the minimum dietary diversity score for women, which captures nutrient adequacy, and the alternative healthy eating index 2010, which captures NCD risk, in order to compare their performance with that of the GDQs. Now I'll briefly summarize the main results of our validation work. Overall, the GDQs and GDQs positive submetric were quite sensitive to aspects of both under and overnutrition, while the GDQs negative submetric was not usually as sensitive. In general, we found the GDQs and GDQs plus also performed as well or better than the ANH2020 or MDDW in predicting outcomes in both the cross-sectional and cohort analyses. So we analyzed data from the Millennium Villages project, which included FFQ data from about 1,600 rural women across 10 African countries, where we found the GDQs to be significantly protective against nutrient inadequacy, anemia, and low mid-upper arm circumference in age and season-adjusted analyses. We also found similar results in a multivariable adjusted analysis of around 1,600 women from a dietary survey from Ethiopia. In the Ethiopian survey, we also had data on additional biochemical measurements. We found that the GDQs was protective against low serum folate and low ferritin. Next, we have an analysis of FFQ data from around 3,000 mostly rural women from the India Migration Study and Andhra Pradesh Children and Parent Study, where we found the GDQs to be protective against nutrient inadequacy and underweight in age-adjusted analysis. My colleagues also found that the GDQs and MDDW were positively associated with overweight and hypercholesteremia in this population. One thing to note is that multivariable adjustment wasn't possible in this dataset, meaning these results could in part be confounded by socioeconomic status and may warrant some further exploration to better understand the independent predictive value of the score against health outcomes in the context of Indian diets. We also analyzed around 5,000 FFQ and about half as many 24-hour recall measurements from urban and rural women in the Mexican National Nutrition Survey and 24-hour recall data from around 15,000 women in the China National Nutrition and Health Survey. In both China and Mexico, In multivariable analysis, the GDQs was associated with a lower odds of overall nutrient inadequacy, and in urban areas of both China and Mexico, the GDQs was also protective against metabolic syndrome, defined as having at least 3 of 5 ATP3 risk factors. In urban China, we also found the GDQs to be significantly protective against anemia. Finally, we have results of longitudinal analyses of cohort studies, beginning with the Mexican teachers cohort, which includes data on over 80,000 women in urban and rural Mexico. In multivariable analysis, we found increases in the GDQs were associated with concurrent decreases in both weight and waist circumference, and vice versa. In multivariable analysis of the Nurses' Health Study 2, including data on 82,000 women across the U.S., we similarly find that increases in the GDQs were associated with concurrent decreases in weight, and vice versa. In the NHS2, we further found that increases in the GDQs were associated with reduced risk of incident type 2 diabetes, and vice versa. Overall, performance of our GDQs appears quite promising, and we're planning to officially launch the metric around the end of this year. At the same time, we're developing an interesting software-assisted GDQs collection system for primary assessment of the GDQs, which we will also look forward to showcasing at the metric launch. The next step now is to validate the performance of that instrument in primary data collection, and ultimately to facilitate uptake of the metric and the instrument in surveillance and research platforms globally. Thank you very much.